Welcome back. Well, people who are diabetic know all too well the frustration and pain that comes with neuropathy. So here to tell us about a natural solution is Dr. Jonathan Stevenson from Strive Neuropathy. Good morning to you, doctor.
Good morning, Tiffany. Thank you so much for having me on this morning.
Yeah, thanks for joining us. I think that's a true statement. People who have diabetic neuropathy know it too well, and other people are kind of confused. What is it? So can you explain a little bit about what neuropathy is?
That's a great question. So neuropathy can affect people in a lot of different ways. So it can start with pins and needles, or it can be very painful. So a lot of people describe it as almost like steak knives they're stepping on. So very affecting their day-to-day life, but it can also affect balance and coordination. That's one of the most common reasons we see people in our office for neuropathy.
Well, that would be terrible. If you're stepping on your foot and it feels like a knife going in it, there's no way you could balance on that foot or step on it solidly. So what causes it? If it feels like that, is it nerves?
Yep. So it's really those sensory nerves. So the breakdown of those sensory nerves. And one of the biggest contributing factors is microcirculation problems. So meaning that those nerves aren't getting that good blood flow that they need in order to function properly. So what will start to happen is they'll start misbehaving. So they're not going to communicate properly to each other. So we'll start to see that decrease in balance, the pain, numbness, tingling, which will make it very difficult for patients to sleep at night. Sometimes the sheets are too sensitive, but also really prevent them from doing activities throughout the day. So we run into patients that aren't able to pick up their grandkids anymore, or they're not able to go for walks with their friends and their loved ones anymore.
Oh, the repercussions, right, of living with this kind of pain. I would imagine people just get more depressed and more frustrated and more in pain than, as it goes on. So did you kind of mention what the top reason is for it? What is the top reason that people are experiencing this?
Yeah, so that's a great question. We run into a lot of different contributing factors. Of course, diabetic neuropathy being one of them. We even run into Agent Orange exposure. But one of the big ones is idiopathic, where doctors don't know where this came from exactly. But through our different processes that we have in our office here, we can really determine if we can help those patients. So even if they have idiopathic neuropathy, we can see if we can dive in there, if those nerves are still have some life to them, if we can bring them back and really get them functioning properly again.
So when you do that, does this become then like a circulatory thing that you work with, or how does that work?
Yep. So one of the biggest things that we address in our office here is the microcirculation problems, but we also have to retrain those nerves too. So once they start to get the proper nourishment through correcting the microcirculation problems, we need to start retraining those nerves to communicate with each other properly again, but also get those sensory nerves functioning properly so we can start to balance, feel hot and cold properly, and really regulate our body temperature. Because a lot of times people start to get hot and cold spells in their feet, but also in their hands. We deal with a lot of neuropathy in people's hands as well.
Yeah, I think about that. For a very short period of time, I had difficulty with a nerve after shoulder surgery. And I just remember how it was the ulnar nerve. So it went all the way down and into these two fingers, and it was a little numbness and issues. And it was honestly, like you said, I couldn't sleep. It was constantly, it's the only thing you can think about and feel. So sometimes, is this a pinching problem? Because you mentioned getting things almost like better aligned and such. So is sometimes this a matter of fact that your body is pinching in the wrong spot? Is that ever the problem too?
That's a great question. So that's why we do a very comprehensive exam in our office. So we'll even check people's spines too, because remember, these are the peripheral nerves. So what's going on with those, the central nervous system, so the brain and the spinal cord, we want to make sure they're communicating properly throughout the entire body to one, get the best results, but two, make sure that this doesn't come back again too, because we know this is a chronic progressive disease. So if left untreated, this can continue to get worse.
Oh, that sounds terrible. Okay, so I know that you do this nerve scan, and I want you, because you're doing these free consultations for the first 20 callers, and I'll give all that information in a second so you don't have to do that. But what is the consultation consisting of, and what is the nerve scan?
Really, two goals from that is to really determine if you have the type of neuropathy that we can help with, and then also to find out how this is affecting your life. Most people don't come in here because of the symptoms, but they come in because of what it's preventing them from being able to do in their day-to-day routine. So whether it's taking care of their grandkids or just going for a walk with friends and family.
Doesn't it shock you what we live with? You know, things that can be helped or changed, and we just choose to live with it because we think, well, maybe this is a normal part of aging. So I'm so glad that you addressed this today, and I'm hoping we'll get some people in to maybe change some lives and get rid of some of that pain for people. Thank you for joining us, doctor.
Yeah, thank you so much for having me today, Tiffany.
Absolutely. And here's what the doctor's doing. He's giving the first 20 callers for you to call Strive Neuropathy. You can get that free consultation and the nerve scan, along with a copy of their book. It's called Natural Solutions for Neuropathy. Here's the phone number, 262-624-0662. Or for more information, you can always go to their website, strivechiropracticwi.com. But get in on that first 20 callers.